Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio, and I'm real glad that you could join us for another segment. We're going to be speaking with Mr. Vincent Myers, president and co-founding member of DIGroup Architecture. It's an award-winning design firm in New Brunswick, New Jersey. He's joining us to talk about why senior living has become a healthcare product. That's according to Senior Housing News in their top 10 trends for 2021. And he's also going to talk about where architectural design fits into this new dynamic. Welcome to Health Professional Radio, Mr. Myers. Thank you for joining us.
Neil, it's my pleasure to be here, and thank you for having me.
Great. Well, as president and co-founding member of DIGroup Architecture, obviously you're into design. Give us a brief look into your professional background. Tell us a little bit about yourself and talk about DIGroup's mission.
Absolutely. So, yes, my training, I went to Syracuse University. As you pointed out, I'm president of DIGroup Architecture. We are a African-American owned MBE firm, and I'm president of the company. I have multiple licenses throughout the country, probably in at least 7 states at this point, primarily providing design services for senior living projects with leading developers of senior housing in the United States. So that's a little bit of background about me. With regard to DIGroup Architecture, we are, as I pointed out, an MBE firm. We like to describe ourselves as an MBE firm with capacity. We are a roughly 30-person architectural firm with offices here in New Brunswick as well as Philadelphia. Our work covers, in addition to senior living, which takes us into other states, we have 4 other market sectors, and we provide design services in downstate New York, New York City, all the boroughs, New Jersey, pretty much the entire state, as well as Philadelphia. So that's pretty much our geographic footprint. But again, our senior living portfolio, our senior living work takes us to Arizona, Mississippi, North Carolina, South Carolina, Virginia, Florida, Alabama, et cetera. So we have a pretty healthy background in senior living design from that perspective.
When it comes to healthcare products, especially for our seniors, we're inundated with ads about this product, that product, or the other. But when it comes to where they're going to live, that hasn't been top of mind as a healthcare product until, I assume, here recently. In their top 10 trends for 2021, I mentioned that Senior Housing News noted a kind of a paradigm shift, reshaping senior living away from the hospitality industry into the healthcare industry as sort of a healthcare product. From your perspective as an architect, how do you see senior living as a healthcare product now?
Okay, so it's a great sort of shift that's occurring, but it's really interesting because I'm familiar with those trends. We study them. I study them pretty extensively. And it's really interesting because within senior living, there are different areas that we would describe as senior living. There's independent living, there's assisted living, and assisted living, particularly here in New Jersey, is licensed. Memory care is also licensed in conjunction with assisted living. You have skilled nursing. Skilled nursing has always been, that's 24/7 nursing care. So skilled nursing has always been a health care service just because of the nature of the people who are in skilled nursing. Skilled nursing, that's the equivalent of nursing home for people that may not know that. So, those are the primary sectors of seniors. Sometimes they're co-located on a campus. Sometimes they're individually located, meaning you could have an independent living community that doesn't have any of the other services. You could have assisted living with memory care or assisted living without memory care. So those are the different things. The real what happened during the pandemic was that there was a real focus placed on safety, given the most seniors being very frail, particularly in skilled nursing environments. And then what emerged from that is, and in a good way, people paying more attention to, making sure that any senior facility at least has some safeguards to protect seniors. The real thing that has triggered, I think, the shift is not only the pandemic, but the reality before the pandemic that the average age of seniors going into any privately owned environment or publicly owned environment, the average age of was 85 years old, right? So even if you had a senior that was going into an independent living community, that community has to figure out how to provide some health care services, right? They have to provide some services that are connected back, whether it's medication or things like that. They have to be very careful because unless they are a licensed healthcare facility, they can't dispense medication, right? But they provide support services, as part of their services. So skilled nursing, assisted living, every single environment that is geared for seniors is starting to recognize that because of the age of the seniors going into their facilities, they have to provide services somewhere. Now, some are more creative than others because the idea is people get uncomfortable when they think that they're going into a healthcare environment. So really sophisticated providers create a way for seniors to live, and the healthcare component almost becomes not totally invisible, but is there for them, can respond very quickly, but is invisible to some extent depending on what kind of service. So if you're going into a high-end life plan community, you don't want to get confronted with the fact that it looks like a hospital, right? Like that it's a hospital. You want to enjoy your life, but you also want to make sure that you and or your spouse, if you're there with with a partner, that healthcare is readily available at your fingertips because it's just the nature of where we are. Years ago, the average age of people going into senior facilities was probably 65 years old, and which is astonishing, right? When you think about it now, I'm 61, and I just can't imagine, retiring and going into a facility, and just sort of sitting in a rocking chair, right?
Yeah. The pandemic has revealed quite a bit to us concerning disparities in products and services in the healthcare industry among different cultural communities. As an MBE, DBE architectural firm, first of all, are there disparities that exist in the design of certain facilities, how they are designed? Are some of these disparities addressed, some of these cultural differences addressed, or is this something that is going to be addressed in the future, at least by your firm? So disparities exist. I think we've seen an interesting kind of shift where a lot of providers are trying to create environments that are certainly open and inclusive for everyone, but in some cases they might provide a facility that might kind of lend itself to a certain community or a certain population or a certain ethnic group. I'm probably less in favor of that. What I would like to see more of is just environments that can cater to different needs, and those needs might be cultural. Those needs might be how and what types of food are served and things like that. And so I get it. There is a place for people to test those waters and to with the eye towards providing healthier places to live and that are more welcoming, culturally aligned, right? And so you're seeing those, you're seeing some
some of those areas pop up. The reality of it is that the biggest disparity is just one of really income. Many of those services, whether they're skilled or whether they're assisted living, particularly when you get into private pay, which is what assisted living and memory care is all about, and independent living, if it's not affordable housing, those services and those places have high barriers to entry because of the economics, right? So in some instances here in New Jersey, to get into an assisted living place, you might be paying $5,000 or $6,000 a month, and to have some services, and it goes up from there. And so that's, when you think about that, and people are retired, they're basically living off their pensions, and they're providing, some people have savings and can live in those environments. And on the skilled nursing side, if you're really desperate and you have to go into a facility, essentially you wind up having to take your economic resources, or the bottom line is you can't have any economic resources when you go into those places because they take them if you have them. And then, because those individuals are living off Social Security or other, Medicaid, Medicare, and, so it's a very difficult environment for people. What we've seen, what's been really interesting for us is in other parts of the country, certain developers are kind of looking at that middle market, people who are, it may sound strange to say this, but they're
financially challenged.
Yes, and they're middle, they're middle America, right? Mm-hmm. And say they don't have a lot of resources. These are in rural parts of North Carolina, as an example. And one of our clients, was looking for a price point for assisted living, that enabled people that were on Social Security and just had, maybe some light support from family members, but to get them in a really nice place, get them in a place that services, get them the rehab that they need, and in an assisted living environment that normally has a higher barrier to entry.
Vincent, give us a website where we can learn a lot more about DIGroup Architecture and about some of these trends that Senior Housing News has been talking about.
First, our website is DIGrouparchitecture.com. Also to the point of just, healthcare and things like that, we take our work very seriously. Within our firm, one of our other market sectors is healthcare. So our healthcare studio, led by Bob Ryan and myself, on the senior living side, we collaborate very often. And we also talk about providing solutions. On our website, as an example, DIGrouparchitecture.com, we did a white paper that talked about protected visitor suites in senior living environments so that people could visit residents and their family members in institutions and residences and be safe. And I think even though the pandemic might be winding down, it's just such a great opportunity to create a safe environment. From the standpoint of resources, people should look at Senior Housing Business. I read that's a monthly publication that's also online, and there's just a lot of information there about what's going on in the senior living industry, and that's one of the publications, as well as EFA, which is Environments for Aging. I look at both of those and just make sure that the firm is up to speed on different documentation and things like that.
Well, Vincent, it's been a pleasure speaking with you this morning. Hopefully we'll have an opportunity to speak again. And I appreciate you taking the time this morning to speak with us. Thank you so much.
Neil, my pleasure, and good luck to all your listeners. And obviously, if you have any questions, you can reach out to me. I appreciate it.
Right. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Vincent Myers, president and co-founding member of DIGroup Architecture. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.